Welcome to Doing Death Differently, a community honoring the culture of death. I'm Bethann, your guide in exploring end-of-life care and the art of dying well. As a death midwife, a hospice nurse, and end-of-life educational consultant, I am here to facilitate meaningful conversations and transform how we approach death and dying well. This session is titled Aftercare, the Body. In our time together, we'll explore how to care for the body, bathing, cooling the body, and frequently asked questions. I am so glad you are here. How to care for the body after death. The ways that we care for a body change depending upon culture, location of death, time of year, access to cooling devices, condition of the body, type of death, our relationship to the person that died, the relationship between us and who we are doing the work with, and even how we feel in the moment. This is a non-exhaustive list of the factors that may influence how a community cares for the body. There is no right or wrong way. Care of the body can engage our hearts, minds, bodies, and spirits in a compassionate way and can help to facilitate healthy grief processes. The purpose of preparing the body is to present the body in a way that honors the individual according to their wishes, as well as the needs of the loved ones involved in the care of the body. The idea of providing body care may be uncomfortable for many people because so many people in our country have become culturally alienated from caring for our dead that this is understandable. Those who do elect to participate in after-death body care often find that it is not the mysterious and technically difficult undertaking it is made out to be. It can actually be very supportive and fulfilling. Rigor mortis, also known as stiffening of the joints and muscles. Rigor mortis typically sets in within the first few hours, but does not happen in all cases. The degree or the amount in which rigor mortis is present varies from person to person. It will affect the mobility of the limbs and the ease of moving the body, so many people find it easiest to bathe and dress their loved one within the first few hours. If you choose not to start early or you don't have that option, you can still care for the body in other ways. Sometimes people choose for rigor mortis to pass to begin care, which typically happens about a day, but it can also be 1 to 2 days. The eyes. If the eyes remain open after death and you wish that they be closed, make sure the eyes are clean and dry, and gently bring the lids down over the eyes. Take a Q-tip or cotton ball and elongate the cotton to catch the lids and keep them shut. Other methods of keeping the eyes closed include placing a weight over the eyes, such as rice or sand. Place this over the eyes and keep it in place until the lids remain closed. This usually takes a couple of hours. The mouth. Using a soft toothbrush, you may choose to brush and or floss the teeth. You may also use a cotton swab dipped in mouthwash to clean the mouth and put moisturizing oil or lip balm on the lips. If the mouth is open and you wish it to be closed, use a necktie or a long piece of material like a scarf or a cloth bandage. An ace bandage also works well. Bring it under the jaw and tie a knot on top of the head. Using 2 people is the best approach. One holds the mouth closed while the other ties the knot. Keep this in place until the mouth remains closed without a tie, and usually this takes 1 to 2 hours, but it varies. It may be impossible to completely close the mouth. If it remains open and is troubling, you can consider filling the mouth with flowers or herbs. Bathing the body. Bathing of the deceased can be a simple act using soap and water, Or it can be an elaborate ritual using essential oils, prayers, music, or whatever is desired. It can take place on a bed or a table, indoors or outdoors. People often choose to bathe as a symbolic gesture of loving, hands-on care that is usually the last physical contact the family and community have with the person. Sometimes the bathing is to present the body with as much dignity and beauty as possible. If the bath occurs on a bed or table, cover the area with a plastic sheet, a tarp, a shower curtain, or some material that you don't mind getting wet or dirty. And the items you use for the bathing process can be everyday items that are used regularly. I have found that a very effective way to moisturize the skin is to use products such as lanolin, shea butter, coconut oil, or even butter. Now I'll speak about cooling the body, which is a main component of death after care. If you're keeping the body at home for less than 24 hours, turning on the air conditioner or opening windows to let air in may suffice. However, if the home funeral is to last for a number of days, other methods may be necessary to keep the body cool, which slows down the process of decomposition. Embalming is not required. Some cooling methods that can be utilized for home funerals include Techni ice or other polymer refrigerants, dry ice, cooling vests or towels, gel packs. Remember, families have been caring for their own for thousands of years. With this information and support, you and your loved ones can have control over this profound and precious moment in your life and receive enormous personal benefits that come with making these important decisions for yourselves. As an end-of-life consultant, I am here to transform your final journey into a meaningful, personalized experience. I offer comprehensive coaching programs individualized for you, and also consulting sessions focused on specific topics to help guide you. My approach is rooted in compassion, expertise, and a commitment to empower you. We will explore ways to make your final chapter rich with significance and comfort. To learn more about how we can embark on this important journey together, please visit my website, BethannDuval.com. Your final chapter is important. Thank you.